Hi, a good day to everyone. Welcome to my channel. Bienvenue à mon chaîne. Yes, this is the moment. The moment I have to reveal and tell the inner emotions or feelings bothering me for almost 2 years now. And it is only through blogging that I was able to release. Only blogging, only in this platform that I'm making a video blogging that comforts me, because I am alone in this world. I'm not really in the world. I am alone in this place, battling, trying to solve all the matters that I have in my life here in France. Well, this is what I call now the end point of my emotional suffering. Though, I mean, it's not the end of all, but the end of my emotional suffering, because it clarifies now the questions and the queries as to why Didier is having his medical crisis. It's too difficult to express, and it's too painful to tell to the people what Didier is having on right now. This is the moment that I have to tell you the truth. Didier, my husband, has been diagnosed with bronchial carcinoma. Yes, you heard it right. A lung cancer that has been bothering him and has been metastasized into his brain. Yes. It was at this point that the doctors reached the final diagnosis on the first week of his hospitalization. The doctor explained to me as to what extent Didier has. And hearing this update puts me into like in front of a bomb. I want to explode. But it seems like something is holding me back. I was totally numbed and speechless. Para bang ako'y nagkaroon ng bangungot. Hindi ko maikakagalaw, hindi ko maigalaw mga paa ko. Para akong nabuhusan ng mainit na tubig. As if something is holding on, that puts me to a full stop. Like, it took me about half an hour to digest what the doctor had told me. It took me about half an hour. I couldn't do anything. I'm alone. I was wishing somebody can extend his arms and say comforting words to me. I told you, it's too difficult staying alone here, wherein you don't have anybody to share with all your troubles. But then, though it was during those few minutes, I felt the emptiness. I wanted to release all my emotion just by repeating deep breathing and sigh. It was through this physical things I can release my emotion. out into an open. It took us a while to have this diagnosis of Didier because it was overlaid by a lot of health problems he has. As I've told you, he started 2019 of CVA, though he recovered a few months after. Then, same year, he developed chest problem. And in the middle of 2020, he has cardiomyopathy that the doctor had advised him to do stenting. So he underwent angioplasty. 4 balloons has been placed into his heart because most of the arteries are partially blocked. Then he stayed few weeks in the hospital and returned back home. He recovered. Stay quiet with me. And again, in latter month of 2020, he has respiratory problem. He develops respiratory problems. Again, I have to send him to the hospital to find treatment of this respiratory distress because he has difficulty of breathing and too much coughing. So he was diagnosed then of pneumopathy, some chest problem that you have to resolve by treatments, antibiotics, and so on. He had a series of diagnostic tests, scanning, MRI, chest scanning, fibroscopy, bronchoscopy, and so on. It was during that time that the doctor has found a small nodule on his bronchus, about 4 mm, something like that. And during his hospitalization, I wasn't able to be on his side. I can only be there for an hour, an hour, not even each day. So since he's so conscious, so the doctor has explained to him about this finding. But then, when pneumopathy was resolved, he was discharged home again. I never been able to know the final diagnosis about the second admission, but all I know is just his lung problem was resolved. Okay, so we continued life. He recovered well, enjoying back the life with me. Then, because after this stenting was done, when they found out that there was also a partial blockage of this abdominal artery, that the artery that's been supplying into his kidneys and to the lower part, he was scheduled that time to have a vascular operation, but it was not pushed through that year because of his lung problem. So it was then until this year, January, the doctor has decided to put him into a schedule for a vascular surgery to repair his abdominal artery that has blocking his supply into the kidney. So he stayed about 2 weeks there. The operation went well. He stayed in the operating theater 6 or 8 hours, then put into the immediate recovery room for observation for 4 days, and put to the ward to private room on the remaining days stay there. So he consumed about 2 weeks staying for complete recovery from this operation. But then the doctor finally, since he's okay and all right, the doctor planned to send him to a recovery facility. But Didier totally refused it. He wanted to stay at home to continue his recovery with me. He has put his trust in me for his complete recovery, and that's it. He was discharged home from his surgery, vascular surgery, and stayed with me and start his recovery. He was fine, though the weight was reduced about. He lost about 10 kilograms from 80. He was 70 kilos. But I was expecting, because of the surgery. For normally surgery, you will start with liquid food and so on and so forth until you'll be normal, that you can be given a normal food. So I never expect these things to have to have some effect of another big problem. Yeah, I thought it was just normal for the surgery. But then after 2 weeks, after 2 weeks of discharge at home, I found him have a very less cognitive power. I mean, he is a little bit confused and he lost some memory. I thought all the while that it was just a result of the prolonged anesthesia he has during surgery. So I never bothered to have a consultation of this or our family doctor. We continued because I have to send him at least 2 times a day, ambulating or walking around a few blocks at home. And one day, on the third or the fourth weeks like that, I found him when we were walking around the block. I found him not so well in walking, and he feels like he's deviating towards the left side. I thought he was just so much fatigue and cannot sustain anymore the ambulation or the walking, so we hurried back home and rested. And until a month after that, I found the confusion was so strong. He's not able to remember some events. And to the point even that he forgot our PIN code, our bank code, our computer code. To that point. So it was a big crisis for me because I cannot do any transactions. Everything has to be done by card now. For every groceries, paying bills, some sort of like that. So it was, my God, like, what can I do? I could not use the card because he totally forgot it. So I tried to resolve the problem. I talked to the banker because after a few weeks of doing so that we have tried several times, it was completely blocked. The card was blocked. So I talked to the banker. We arranged these things until we were able to find a good solution for that. That's it. So after 2 months of recovery, recuperating from the surgery, the same. The memory is still losing. It's not coming back. So I said to myself, no, it's not coming from the surgery of the prolonged use of anesthesia. That must be something else on the brain now. So I was expecting he might have some cerebral vascular accident. So I called our attending physician I asked him about the problems, so he scheduled him for brain scanning. And it takes time for me to get an urgent schedule. The list had been put into the schedule on June 21, so that was a month after my consultation to his family doctor. So it's a long time to wait. I cannot wait until the time. So I have decided to put Didier to the hospital because I want an urgent answer to what is now bothering on his brain. Though blood pressure is normal, but the only thing, confusion and body balance is in trouble. So that was the thing that bothers me, to put him back for admission in the hospital. And in this place, France, it is not easy to admit patients here. It's not like Philippines that anytime you want to admit a patient, you go to the nearest hospital and say what is problem. Or that's it, you can be admitted right away. No, here it's not. The only way to have him admitted to the hospital is to ask an ordinance from his doctor or to call the ambulance as an emergency case. But it happens on Sunday. So I don't have any access to the doctor, but I can call the ambulance for an emergency. So that's what I did. I called the ambulance as an emergency case. He has to be in the hospital. He has to be admitted because of some, he started to have a difficulty of speaking. He has the difficulty to speak. There was problem in speaking for him, and so with mental confusion. So in this way, he was admitted. The SAMU came. SAMU here stands for a service the aid medical. This is an ambulance car. I have called 112, and in a minute they came to answer my distress call. And this is what they call SAMU, SAMU, Service the Aid Medical. This is under the public health control. So that's it. They bring him to the hospital. That was May 30 this year. Then, series of diagnostics, some procedures. A lot of procedures has been done to him because they thought all the while it was just the cerebral problem. So after a few days of these diagnostic procedures, the doctors found out that this brain problem, this confusion, is already the trouble that the metastasis has been doing in his body. It was because of this bronchial carcinoma. The nodule that has been found previous year has become already from 4, it becomes 34 mm. So huge and so rapid that it has increased rapidly. And tumors in his brain they have found about 3 tumors in the brain that causes him to have imbalance in walking and confusion. That's it. That's it, really. It was at this point that I thought it was the end point of my problem. But only then, my problem has been upgraded back into a bigger problem. It has upgraded back into another huge problem. But then fine. I trust the technology to have a complete treatment for Didier. But most of all, I trust God for the miracle and the complete healing of Didier. And allow me to thank some of my friends who sent me personal messages into my personal account, giving me some solace and showing their sympathy on me. I'm thanking you all about these things, especially to Gigi Bailosis, a close friend of mine who is now a nurse in one of the heart hospital in Singapore. Gigi, Marietta, Jeffcott, Rhoda, Cameron Medina, some of the friends, because these friends who constantly talk to me on my private messenger, and Gigi also, who is always sending me verses from the Bible, some healing words from her pastor, I mean, and so comforting messages on my timeline. And thank you all for that, and for my friends who continuously also send their sympathy to me. Thank God. And that's it. I mean, sorry, I have to tell this also, that I never had told anyone, neither my family, about this diagnosis. Because after receiving this diagnosis of, this diagnosis for cancer, for carcinoma, I totally closed. I feel I have no links with the outside world. I totally stopped myself from communicating on my Facebook. I stopped myself from talking to people on my in social media. And I'm so sorry to my family that I stopped answering all your queries on my personal accounts on Messenger, on our family chat room. I'm really so sorry. I don't have the guts to tell you. I don't know where to start and how to start answering your question. I don't know how to start telling you. So now so that's it. This is the moment now. I'm telling you his diagnosis. I'm so sorry for this 2 weeks to my family, that I put you into too much trouble, wondering why I'm not answering, wondering my silence, keeping my silence for 2 weeks, have put you into trouble. I mean, you feel hurt and you feel bad. Why I'm not answering you for 2 weeks? And that's it. And that's it. I forced myself not to open to anybody in social media, because I was totally assimilating all the health issues of Didier. But only then, after these few weeks, that I have come back into my normal self. I have recomposed back myself to answer your question. And this platform, through my blogging, I was able to express to you all that I had, and what's troubling me in the deeper sense of the problem. And that's it. And that's it. For now, I am obligated to be around with Didier all the time, or until when she can sustain life. Maybe I will be in this platform. I will be asking those friends or those someone who can help me pray to the Lord God for his recovery, that he can sustain not only this technology that can bring him back to recovery, but through God and through the mercy of God that keeps him complete healing and recovery. That's it. I thank you all, and I will be telling you more on my next blog. I'm sorry, this is quite a sad revelation, but at least I have brought out my emotions, that releases all the troubles I have in my heart. Once again, thank you. Subscribe my channel and make a lot of share. Bye.